Good afternoon. It's a little bit after 12, but welcome and thank you guys for joining Measles One on One in 10 minutes with the Houston Health Department. My name is Latrika Staten, and I am the Division Manager within the Office of Chronic Disease. Today, I'll be talking to you a little bit about how measles and chronic disease are linked. The important thing here to notice is that our office really focuses on education and prevention of chronic diseases. So we focus on providing individuals with behavioral and lifestyle change courses that really impacts them before they have chronic diseases, as well as teaching them skills to really manage and control those chronic diseases when they're officially diagnosed. So at this particular point, you're probably like, what does this have to do with measles, right? So the important thing is that measles really impact those with chronic diseases simply because if you have a chronic disease and you have measles, then you may be at higher risk for severe complications, and that could lead to increased hospitalizations or even death in some instances. So what I'd like to do today is really just dive in a little bit more of how you can protect yourself in managing chronic diseases, how you can be preventative in making sure that you do not contract measles as well as those that are around you through vaccination. And so here the theme is going to be prevention is key in all that we do, with the motto of making the healthy choice the easy choice, and that includes vaccination and prevention. And good morning. I see you guys coming in through the chat. So I'll just start to say some of the questions that we often get when we are providing education within the community to those that may have a chronic disease. And there's things, we see spikes in cases and diseases such as measles is, how does that impact me? And how do I know if it's something that I have? And so I think it's very important for everyone to just know the general understanding of what measles is. Measles is really a respiratory virus. It's spread through things like coughing or sneezing, things like that. It's highly contagious. And again, it has severe consequences for those who may already be living with a chronic illness. So it's important to know that the symptoms currently are runny nose, cough, high fever, red, watery eyes, and of course, the main one being a rash. Now, some of those symptoms do mimic other things such as allergies. We're here in Houston, in Texas. So it's very important that you do not self-diagnose yourself, and that if you feel that you have been exposed or that you're exhibiting any of those signs, that you reach out to your primary care provider for additional guidance. If for any reason you don't have a primary care provider, then some of the resources that we share with our chronic disease individuals is that you can always reach out to our Houston Health Department at 832-393-4220, and they will be able to answer some questions and get you to the right individual, whether that's us here in chronic disease or some of our fabulous staff that's working on really combating and monitoring the measles cases that we have in Houston in our epidemiology department. So to add to that, a lot of people here in Houston are living with chronic diseases such as diabetes, asthma, heart disease. So those that may have these particular conditions are already at an increased risk for having a diminished immune system. Basically, what that means is that your immune system is not able to fully do all the work that it needs to do to protect you. So if you were to contract something like measles, then it would put your immune system in overtime. And that's really one of the reasons why it can lead to severe complications such as pneumonia. It can lead to things that really impact that respiratory system, like asthma. So one of the things that we really tell those with chronic disease to do is to work on managing those symptoms and those risk factors now. So you want to make sure that you are living a healthy lifestyle, you are eating healthy, you're engaging in physical activity. Most importantly, you're staying up to date with your vaccinations, and you're speaking to your primary care provider on a regular basis. Again, we're going to say prevention is key, right? And again, in living a healthy lifestyle, we talk about those vaccinations. So the current vaccination recommendation, even for those living with a chronic disease, is to have that MMR vaccination. Again, we want to make sure that you are protecting your family and your loved ones. And so the MMR is really recommended in a 2-dose series, starting with infants around 12 to 15 months for the first dose, and then again at 4 to 6 months. However, if you're one of our wiser residents within Houston and you're unsure if you have been vaccinated, that is a time for you to reach out to your primary care provider to really get information about your medical record if you don't already have access to it, or additional testing just to make sure that you have those antibodies. Again, and I see questions coming in, and I'll pause in a second to answer some of those as well. So just making sure that you're doing everything that you can to kind of combat and make sure that you're not putting yourself at a higher risk for infection. So one of the questions that we do have in the chat is, how does my nutrition factor into contracting measles? So with that, your nutrition, from my point of view, would be, how does your nutrition play into you developing chronic diseases? So the chronic disease is highly based off of what you put into your body. So you want to make sure that you're eating right, you're getting the right mixture of fruits, vegetables, fiber, really abiding to those CDC guidelines and recommendations for a healthy lifestyle. How that then leads into you having measles is that if your body is already not up to par, then it's harder for your body to fight off infections such as measles. So it's not directly that not eating healthy is going to be you at a higher risk for measles, but it's going to be that all those risk factors combined with you potentially having measles might lead to additional, complications in care. And that's really how chronic disease ties into what we see happening right now in measles. So it's not necessarily that this is going to be the things that prevent you from getting that particular virus, because again, we want to make sure that you are getting vaccinated. That is the easiest and most effective way of prevention, is to get that MMR vaccine, which is about 97% effective, and it's safe for even those living with chronic conditions. So that's kind of where we're at today. Something else that I just want to again pinpoint, and again, I know we started a little bit late here today, but I will be back later for another live, is that if you have questions regarding how you can start to combat some of your chronic diseases so that you're really preventing your additional risk factors for severe complications from not just measles, but any type of virus, then you feel free to reach out to us here at the Office of Chronic Disease. You can find our information on houstonhealth.org again, or you can reach out to our call center at 832-393-4220, and they would definitely link you back to us. And just before I wrap up, I will say that being healthy and managing your chronic diseases also includes you being physically active, you ensuring that you're eating properly, your nutrition is on play, that you are having those tough conversations with your healthcare provider, and you're being truthful with any symptoms or anything that you're experiencing. And last but not least, making sure that you include staying up to date with your vaccination schedule to your daily or annual check-ins. Those are the most important things for prevention. And so one last question, and then we'll wrap it up. The question is, could you repeat what factors of my health affect my immunity from chronic disease again? Again, chronic diseases are going to be risk factors that are going to add into, if you do contract measles, then it could possibly lead to severe complications. But again, if you want to make sure that you're combating chronic diseases across the board, you want to make sure that you're physically active, that you're eating healthy, that you're having conversations with your PCP, primary care provider, that you're engaging in education and making yourself aware of the lifestyle changes that are needed. And lastly, ensuring that you stay on track with any of the recommended vaccination schedules. And again, for this case, for measles, that would be ensuring that you've already been vaccinated with MMR or MMRV. And if not, contacting us for more information. If you have any other questions, drop them in the chat and we will be sure to answer them next time. And see you guys next week for Measles 101 in 10 with the Houston Health Department. That went